Okay, moving on to the hypersensitivity reactions. There are four different types of hypersensitivity reaction. The first is immediate hypersensitivity, which we commonly refer to as allergies. The second occurs with formation of tissue or organ-specific antibodies which attack our tissues. The third is a reaction caused by antigen-antibody complexes, for example, serum sickness. This is also indicative of systemic lupus erythematosus. And type 4 is involved with the delayed type of hypersensitivity reactions, for example, contact dermatitis. They're caused by specific proteins that are able to get through the barriers of our innate immune system, like the skin, and cause infection. So in this one, we're going to go into kind of more depth on these four types of hypersensitivity reaction, each in their own turn, and then in the next one, we're going to talk about immunodiagnostic technologies and go deeper into systemic lupus erythematosus. So let's get into it. Type 1 hypersensitivity reactions are the allergies that we commonly experience. So mediated by immunoglobulin E antibodies and allergen-specific T cells, immunoglobulin E binds to mast cells, inducing the release of granular contents such as histamine, which cause the symptoms of allergies like rhinitis, the scientific term for a runny nose. Symptoms tend to manifest as asthma, eczema, which you can see on the top right, rhinitis, food allergies, and swelling that you can see also on the top right if you look at that little boy's face. We went over mast cells in an earlier video. We talked about how immunoglobulin E binds to their membrane, and when these immunoglobulin E bind to their membrane, it gives them specificity for the antigens that immunoglobulin E pick up. The allergen-specific immunoglobulin E are going to make these mast cells sensitive to harmless allergens. So when we come into contact with these allergens, they bind to the immunoglobulin E molecules on these mast cells, inducing rhinitis and causing the mast cells to release, causing degranulation. So these mast cells are releasing molecules like histamine, which cause a lot of the symptoms of an allergy, which is why if you are susceptible to allergies, you take antihistamines. So mast cells with allergen-specific immunoglobulin E stimulate rapid degranulation upon allergen binding. Mast cells release histamine and other inflammatory mediators that increase the permeability of blood vessels to allow for extracellular fluid accumulation and diapedesis of leukocytes. They also decrease the diameter of airways and secrete mucus to block gates of entry. Remember, we talked about pathogens being able to enter the body through mucosal membranes. So decreasing the diameter of airways restricts access to these mucosal membranes, because the immune system is kind of thinking that these harmless allergens are actually pathogens trying to infect us. So that's why we have all these symptoms to try and get rid of the allergens, because we think they are pathogens trying to infect us. So we're increasing the permeability of blood vessels to kind of recruit leukocytes and other components in the lymph to deal with these infections, decreasing the diameter of airways and secreting mucus to stop these allergens actually getting into our bloodstream, and also inducing gastrointestinal fluid secretion to cause vomiting and diarrhea to expel these antigens. So you can imagine how these functions would be useful if we were trying to stop ourselves getting infected by a pathogen. And this is how we also respond to a pathogen that we've already come into contact with. and we already have immunoglobulin E IgEs that are able to pick up that pathogen. But in the case of allergies, we don't really want this because it's not a pathogen that we're fighting off. It's actually just a harmless allergen that can't do anything to us. And this can become very serious if it ends up in anaphylaxis, which is a severe allergic reaction, where these responses listed above lead to breathing and circulation problems that can potentially be fatal. But we do treat these with epinephrine, which opens up the airways and stops someone in anaphylaxis from suffocating to death. Production of high levels of immunoglobulin E to harmless antigens, allergens, is hereditary and described as atopy, and 80% of those with atopic conditions have family histories of allergies. So the type 2 hypersensitivity reactions are talking about cellular targeting. So they're caused by antibodies, mainly immunoglobulin G and immunoglobulin M, directed against cellular or matrix antigens from tissues. So mostly the antibodies produced here are specific to self-antigens. The antibodies can act as opsonins and cause phagocytosis of healthy cells because they think that these healthy cells are actually pathogens, with phagocyte products further inducing acute inflammation and tissue damage. So kind of imagine a regular healthy cell. Shown here on the right is an example of a red blood cell, an erythrocyte. Our own immunoglobulins are recognizing surface proteins on these healthy cells. The antibodies are binding to them, opsonizing them, and marking them for phagocytosis by phagocytes like macrophages, shown on the right here as the blue cell. The macrophage comes along, envelops the healthy cells and destroys them, which obviously is not good. But then once the macrophage destroys these cells, it releases their contents back into the body, where they're further opsonized by other antibodies that are still going to be specific to those antigens. And also you're going to have inflammation and tissue damage caused by these phagocytes secreting cytokines that are going to induce an inflammatory response like interferon gamma. The antibodies can also activate complements, resulting in complement products that aid in the opsonization of tissues. The antibodies can also disrupt normal cell mechanisms by binding to normal cellular receptors, interfering with their function, for example in Graves' disease. Lupus has some elements of type 2 hypersensitivity reactions, but it's mostly a type 3 hypersensitivity response. So I think I'm going to go over type 3 and type 4 in a separate video because we're running out of time. But the main takeaway that I want you to have from this is that type 1 hypersensitivity responses are just caused by our B cells producing antibodies that are specific to harmless antigens that we call allergens. And these antibodies are just causing the regular kind of immune response, but we're having this regular immune response to stuff that is harmless to us. So it's just an allergy. We don't really have to worry about it, which is why we can just take antihistamines to suppress this normal immune response. And then type 2 is where B cells are producing antibodies that are self-specific, that are targeting our own antigens produced by our own cells. So antibodies are targeting and opsonizing our own cells, resulting in their destruction by phagocytes, which leads to tissue damage and inflammation, which is not good.